Okay, welcome to Marma Self-Care. We're going to focus on the Marma points of the lower body, the lower extremities. And there's not very many Marma points on the lower extremities. And a lot of them can be stimulated bilaterally at the same time. So I'm just going to take you through an introduction of them first, and then we'll do more of a guided practice with legs up the wall if you choose, or in any position that you feel like you can access the points. You can do it sitting down in a chair or on the floor or lying down. Your legs might be a little bit far away from you, but some position that gives you access to your legs is going to be best. And first, a little bit about Marma points. Marma Chikitsa is Marma therapy, and it's a therapeutic modality where Marma points, which are these vital energy points that are distributed throughout the body, are stimulated with finger pressure or with a Marma stick or with essential oils and touch or with tuning forks, things like that. So they're really similar to acupuncture points. And in fact, they map exactly onto the way acupuncture points are distributed throughout the body, almost exactly. About two-thirds of them are exact, and the other one-third tend to be like really nearby an acupuncture point. So it's a system that comes from India, and it was developed in the Indian martial arts tradition. Marma, the word mar is derived from it's a root word for a word that means to kill or to harm. But it just indicates that Marma points are sensitive or vulnerable points, and they can be used in combat or self-defense applications or in healing and self-care applications. And so when you have an Ayurvedic massage, whether it be with hands or with feet, the Marma points are being intentionally stimulated through that contact. The way that the strokes are applied is very intentional in the interest of also stimulating Marma points. So, the best massages incorporate a little bit of awareness of specifically where Marma points are so that those can be worked intentionally. And so we will just kind of come into relationship with our own Marma points and learn how to stimulate them ourselves so that we can develop a relationship to these points for ourselves and and give ourselves a very near at hand kind of self-care practice that you can do anytime. Marma points, I like to tell people just as a way of sort of talking about what they are because it is so deep and it is so vast. Like there is so much to say about these points, but you can think of these points as kind of the outlet for specific channels that run within and throughout your whole body. And in this paradigm, every channel has an origin, like a starting place, it has a pathway, and it has an outlet. And the Marma points are outlets for three specific channels. Those are the nervous system channel. So contacting and stimulating Marma points has a direct effect on your nervous system. And it's very helpful for inducing like a parasympathetic nervous system mode, the rest and digest mode. And the another channel is the mind channel, the mind stuff, the thoughts, ideas, beliefs, and emotions are have their outlet. That channel of the mind has its outlet at every Marma point. And also the channels that are conduits for your prana, your vital energy, your life force energy. So nervous system, mind stuff, and prana are kind of what we are working in relationship with. And basically, at these points, they're kind of like little doorways. And sometimes stagnation can occur in these points, or just sort of some kind of disruption or dysfunction can occur at these points, and that causes pain or dysfunction at the level of the body that we either perceive or do not perceive. And so, by having a relationship with our own Marma points and having a self-care regimen where we stimulate these points, we're actually doing a lot to keep these pathways clear and to allow our vital energy to circulate, to allow our mind to be steady and calm, and to regulate our nervous system. And then there are also more physical sort of like applications for stimulating Marma points. We're working today the Marma points of the lower body, and all of the Marma points of the lower body have like very localized implications, like the ones on the thighs affect the thighs, and the ones on the knees affect the knees, and on the lower legs affect the lower legs, and on the feet affect the feet. Like they're very local in terms of, if you have foot pain, or if you have arthritis in your knees, or if you have soreness or pain in your thighs, arthritis in your hips, things like that, that can be, you know, relieved a little bit through stimulating Marma points. But then there's also just applications for circulation in general around the lower body. People who sit in desks all day or who have long commutes and things like that benefit well from making sure that the circulation of the lower body is flowing well. And and then also there are kind of similar to the traditional Chinese medicine paradigm, you'll find that there are also um, there's a relationship between the points of the lower body and the points of the pelvic structures, the colon, the bladder, the reproductive structures, and also like especially on the Marma points around the lower legs and feet, they have like they reference or they have an effect basically on more distant organs that are in the pelvis. So that's a little introduction. There's so much to say, but that kind of lets you know what we're working with. Do you have any questions right now? Okay.
No, no questions.
Okay, okay. So I'm going to take you through a little tour of of the Marma points and sort of introduce you to where they're located and give you an experience of like contacting them and feeling for them. And then I'll take you through another practice where we're just kind of like go through and touch them and stimulate them with legs up the wall if that feels comfortable, or just kind of in a more sort of like meditative state with less like talking and description. So the first one I want to introduce you to is what is considered a master marma point. Also, the plural word for marma points is actually marmani. So marmani is the plural, marma is the singular. So there is one marma point that of the lower body that is particularly powerful to stimulate, and it is on the tailbone. It's at the tip of the tailbone. And so I'm going to adjust my position to just sort of show you how you might contact that. You just locate your tailbone with a finger and just contact it here. And so it's just like that. This is called trick marma. That's the name of this marma point. And then from there, we have sphinge marma, which is right at the center of where your butt and your legs come together. So right beneath the gluteal crease here. So you can see that and maybe contact that on yourself and just explore what that feels like. Um, let's see. So like basically we measure between structures to sort of find out where each marma point specifically is. And so if you feel for this marma point beneath the gluteal crease, and then you kind of with your awareness just contact the back of your knees, you have this length of leg. And if you measure about halfway down and then come up a little bit from that, that will be the next Marma point. It's called Sakti Urvi posterior. And it's basically you could think of it as just being when I feel it, when I contact it, I feel it kind of like at the kind of the meatiest part of the biceps femoris muscles on both sides. You can kind of feel that meat there, and you can feel where there's a little, almost like a little space between two structures. You can kind of find that, and that's where Sakti Urvi is located. And so you can contact that marma and stimulate it there. And we then have, staying on the posterior side of the body, behind your knees, there's a marma point, just like at the back of your knee pits. And you can touch that and stimulate it and just kind of like locate it with your hands and with your awareness. And then we're going through these a little quicker and we'll go through them more slowly with legs up the wall. But sliding down a little bit from there, we have on the back of the calves, we have there's the gastrocnemius muscle, and it's kind of a heart-shaped muscle in the back. And if you kind of like draw your fingers up your legs, you can have your feet on the floor. I just have mine up to show you, but unless you like this position, you're welcome to take this position. But whatever helps you kind of find the like very center and highest point of that heart shape in your calf muscles. And that is a marma point called Indrabasta. So ideally, you want to be in a relatively relaxed position when you're stimulating your marma points, but you can explore whatever you want, anything position wise. But from here, staying on the back of the body, we have marma points on the just right at the heel, right at the point of the heel. And this is called Parjni Marma on both heels. So you have those. And then on the bottoms of your feet, you have one just right at the center of the bottoms of your feet, kind of right where like the ball of your foot drops into the arch. There are marma points there. Good. And so coming back to the top of the legs, on the front of the thighs, like if you know about your sartorius muscle, you can find these really easily. But also, like if you just contact that Sakti Urvi Marma on the back of the thigh that we found a moment ago, and then wrap your hands around to the front, it's right about at the same level on the front. And it's actually called Sakti Urvi anterior. So it's like it's a partner to Sakti Urvi posterior. And that is actually a little bit lower, a little bit inferior on the body to a marma point that is kind of on the top border of your sartorius muscle and a little bit more medial, a little bit more toward the inside of your thighs. And this is Lohitaksha Marma. Lohita means blood, Aksha means eye. And so it's like the eyes of your blood. And I think it refers to the way that your femoral artery is right here. So you can contact that and feel it. We also have uru, which is if you palpate a little bit and feel for the bony prominence on the outside of your thighs, you have your yeah, like your hip bone on the outside of your thighs. It's your greater trochanter. If you know that structure, there is a marma point here on the outside of your thighs. And so you can contact that and feel it. And then in order to be really precise to find the next one, I'm going to just come onto my knees like this. So you want to be able to just stretch your arms straight down by your sides. And right where your middle finger contacts the outer thigh, there's a marma point there. It's called Uru 2. And so you can find that and just kind of keep your fingers on it as you make your way back to a more comfortable position, if you like. So, and just kind of remember where you feel that, like touch that and kind of contact it and sort of like note it so that you can find it more easily in the second part where we go through these in a more meditative way. And then coming back around to the front, we have Janu, which is right at the center of the kneecaps. So Janu is at the center of the kneecaps, and Janu 2 is at the back of the knee. So that was the knee pit one that we contacted earlier. And then we have two more knee points. And we find these like if you palpate your knees a little bit and you feel that kind of bony prominence inside, inside on the part of your legs, kind of inside, like this bony part of your inner leg where your knee kind of is. It kind of makes up part of your knee. You can touch that and you might find a little sensitive point at the top of that bone there on both sides. Yep. And then from there, you find if you can feel your outer lower legs, your fibula bone, the head of your fibula is right here. You want to go down a little bit and a little bit toward your shins, so medial, and you'll find another marma point right here. So just contacting those. These are charana. Charana is the name of these. Charana medial and charana lateral. And then from here, kind of come to the inside of your shins and about like if you could measure between your ankle bones and your knees, it's not quite halfway. It's like a little bit north of halfway on your legs. And so just contact your shins and touch that marma point there. It's sort of like you can feel the ridge of the shin bone. It's kind of like tucked in right there. Good. I'm going to adjust my angle a tiny bit so that you can see the feet ones a little bit easier. Um, I'll bring this in. But if you look at your ankles, your inside ankles, and you go straight down, about 2 finger widths down and 2 finger widths back towards your heel, there is a marma point there. It's called gulfa. So you find that point and just touch it and note where it is. And then likewise, on the outside ankles, we have the ankle bone. And this one, you just go straight down about 2 finger widths, and you find that just below that bone on both sides. And that's Gulfa 2. And then with your feet a little bit flexed, it's easier to find this one. It's called Paracharana. And it's kind of like right where these tendons in your feet are really prominent. When you flex your feet back, there's a little groove between those tendons, and you can press there. Nice. And then last one is at the very base of your toenail, the very center, there is a marma point. It's called Padachipra, and it's a powerful one. This one is really involved in balance, balance of just being a bipedal creature. It's really involved in balance and locomotion and also equilibrium. So yeah, that's all of the marma points on the lower body. There's relatively very few. So if you like now, you can do you have any questions? Was there any of those that felt harder to find or feel?
Um, I'm absorbing all of them. There were some that were harder to find, but some I could feel exact on. I could feel like a pulse almost. So I knew
Yeah,
it was
yeah.
right on. So some were definitely more intuitive for me. Um,
hmm
some
Which
just didn't
ones
feel
do you remember which ones seemed less easy to find or feel?
less easy. Um,
hmm
I would have to
Okay.
do it in the moment again.
Okay.
There's too
We'll
many to
go through
remember.
it and see. And then you can ask me later, or maybe you'll just find them with another kind of go through. That was kind of quick. So um, I invite you, if it's comfortable for you, to take legs up the wall. This is an awesome position in general to sort of be familiar with and have access
Okay.
to. And The way I like to get into it is to just shoulder up to the wall as close as you can, and then just kind of flip your legs up the wall. And you might have to shimmy in a little bit to get as close as you want to be. But once you find yourself here, just kind of settle in and close your eyes for a moment and deepen your breath. I'll try to make it so that you don't have to watch the video or watch me what I'm doing in order to participate and just sort of stay with yourself. I'd like this to become something that if you like it, like you just practice and you become so familiar with these points that the video is no longer needed. And you can slow it down and you can take as much time as feels right, pressing, stimulating each of these points or whichever points feel like they need more contact and attention. So for now, just settle in and feel into the contact your spine and the back of your head makes with the ground, and just let that feel supportive and soften the back of your body in a way that lets you kind of conform a little more fully to the shape of the ground beneath you. Feel the way the back of your pelvis is supported, and feel the sensation of gravity being reversed on your legs. Just take a couple deep breaths and allow yourself to settle a little bit deeper, become a little more comfortable. Soften your face, soften your skin. And now we'll start with trick Marma, the tailbone. So, whichever hand feels more available, you can just kind of reach back and contact your tailbone from here. It should be reachable, but if it's not, you can also just contact it with your awareness, just using your mind, your attention to go in and contact your tailbone. Coming into relationship with it with your awareness is powerful too. But if you can touch it, go ahead and just press there for a moment with finger pressure and notice the effects. Good. And you can release that and bring each hand to the gluteal crease, the space just beneath that at the very top of your thighs. And with both hands, stimulating this marma point on each side. And noticing any sensations that arise in your body as you hold a little pressure here. Now we come to Uru Marma, the greater trochanter, that bony part on the outside of your hips, where you can kind of feel like you think of it as your hip bone, and just pressing into that bony prominence on both sides. You may notice a spontaneous deepening of your breath as you hold any of these points. And that's a really good sign that there's something to move in there. So let yourself stay with that a little bit longer, especially if you're practicing on your own. And then remember where you felt urutu when you stretched your hands down the outside of your thighs and contacted the space just beneath your middle finger. Find that point again in this position and apply some finger pressure there on both sides. Good. And then wrapping your fingers around to the back of your thighs again, finding that Sakti Urvi Marma, the meaty part of your hamstrings. You have three hamstring muscles and they're distinct, they're separate. And so you might feel for the little grooves between two of those muscles and contact that point with finger pressure on both sides. Good. And then wrap your hands around to the front, and maybe with your thumbs, you find Sakti Urvi anterior, which is right in line with Sakti Urvi posterior. It's kind of at the inferior angle or the inferior border of your sartorius muscle. Or you could think of it as being just kind of in the center of the upper half of your thigh on the front. And when you're contacting this marma, see if you can let your fingers be off of your body if you're touching it with your thumbs so that you're only contacting this marma right now. And then you can experiment with replacing maybe your middle finger to where you felt urutu on the outer thigh, the one that was beneath your middle finger when you stretch your straight arms down, and stimulate both marma points at once if that's interesting. Nice. And then from the place where your thumbs are pressing on Sakti Urvi, come up about 2 finger widths and then medial about 2 finger widths and find basically the superior border of your sartorius muscle and a little bit interior to stimulate lohitaksha, the one that corresponds more directly with your femoral artery. And just notice the effects of stimulating this marma, applying pressure there. Good. And now let's slide down to the kneecaps. You can bend your knees if that helps make them more comfortably reachable, and just let your thumb press at the center of your kneecaps. This is Janu. And if it's available to you, you can wrap your fingers around the back knee pit, just behind Janu, and stimulate Janu 2 at the same time. If that's not available to you, you can do one side at a time. If you want to stimulate both marma points at once, you put one hand on the back and one hand on the kneecap and just do each side. But if it's available to you, you can do both at once. Nice. Just noticing the effects of that. And now bring your, maybe whatever is easier to feel with, but contacting the inside, the inner part of that knee bone, that bony prominence that we consider to be part of the knee. There's a little ridge at the top of that bone, and you can stimulate that either with fingers or thumbs, whatever feels more comfortable. Notice if one side feels more sensitive than the other, or if they feel about the same. Good. And then coming to the outside, we find the head of the fibula. You can feel that. And then just go about 2 finger widths lower than that. And then maybe 1 finger width medial, like toward your shin bone, and press into that marma point. Notice if a little less pressure feels more interesting than more pressure, or if more pressure feels more interesting. Just using your finger pressure to contact that point and send awareness and clarity. And now it might help to bend your knees even more and wrap your thumbs around the back of your calves so that you can find the very center of the heart shape in your calf muscle. This is the center of the gastrocnemius. And just contacting, pressing that with your thumbs, Indrabasta Marma. Keep your breath flowing deeply and evenly. Good. And then from here, we're going to find Gulfa. If it's available to you, maybe it won't be from here. Maybe not the most comfortable, but let's maybe find that in a different position actually. So let's take this opportunity to take butterfly knees up the wall. So let your heels drop down toward your pelvis and your knees separate out. And from here, we can easily find Indrabasta medial. Remember, it's not quite halfway down your shins, and it's just inside that shin bone, that tibia bone. So find that marma point on both sides and just apply some gentle pressure there and notice the effects. Nice. And so from here, what might be a good way to make this accessible is if you need to create a little space between your hips and the wall, that totally works. But take 1 foot across the knee. So you have like a figure 4 configuration with your legs and your ankle is just right there. And you can see your inner ankle and go straight down from the ankle bone and 2 inches or 2 finger widths back toward your Achilles tendon on that side. And maybe on the other side, on the outside of the ankle, you can feel for your ankle bone with maybe your middle finger and just slide straight down about 2 finger widths down from that. And you can stimulate Gulfa 1 and 2 at the same time in this position, while also getting a really satisfying hip stretch, hopefully. Taking deep breaths into that contact, just exploring with your awareness what it's like to receive contact at these points. Nice. And since it's very near, you can take some thumb pressure right to the center of the bottom of your big toenail and press there. Good. And also, um, the last Marma point on the foot is the one at the very like center of the foot, right? Where the ball of your foot meets the arch. It's like it's called Paramadya, which means the middle of the foot. And you can apply some thumb pressure there. You can even apply some gentle, like circular motion at that point if that feels good. Nice. And then let that circular pressure kind of become still for a moment and then can release that contact. And let's switch sides. Bring your leg that was bent up the wall straight and let the other leg come into the figure 4 position. So it's bringing your ankle closer to you. Find the inner ankle and come down about 2 finger widths down and about 2 finger widths back toward the heel or Achilles tendon and press there. And you can also find the one on the outside by maybe with your middle finger, find that outside ankle bone and just slide about 2 finger widths straight down from that and stimulate both Marma points at once. And just breathing into these points. If you need more space between your hips and the wall to make this leg configuration more sustainable, you always take that. Good. And then we can find the Marma point at the base of the big toenail and press there. And then find Pada Madhya at the center of the bottom of the foot, right where the ball of the foot meets the arch. And press there with some thumb pressure and maybe add some circles. Good. And then you can bring the circles to stillness, or just another moment of pressure, and release that point. And you can take both legs up to get up the wall once again, just to kind of feel in and notice the effects. Feel your legs. Feel again the way the back of your pelvis rests, supported by earth. And feel into the way the earth supports the shape and contours of your spine, the way it cradles the back of your head. And to end, you can bring one or two fingers to so find the point between your two eyebrows and then slide up about 2 finger widths above that and just apply not even pressure, but just the contact of the weight of your hand and finger at that point, and just let that be interesting for a moment. Great. And then you can release that. And however you like to make your way back to seated, you can roll onto your side and settle for a moment side lying and just let yourself come back really slowly. Use your arms to support you, making your way back up to a comfortable seat. And once in a comfortable seat, you can also find contact with that pada madhya point at the center of the soles of your feet, and apply pressure there just once more to really help you ground and return. Good. There you are. Thank you for your practice. I hope that you've enjoyed this and that it's been helpful. Do you have any thoughts or questions that you'd like to ask now?
Yeah, I mean, I'd just like to discuss it. I don't know if you want to still record or if we just have
Yeah,
an open
maybe
discussion
we'll
about
have a discussion together. Okay, I'll edit this part off of the end of the video.
it. Okay.
But yeah, all right. So thank you very much.
Yeah, thank you. That was wonderful.